Hello. Today we'll be talking about dentists. So, my mother has had problems with two teeth lately, and it got to the point where she couldn't close her mouth. She's had a hard time with the teeth being very sensitive. She felt like it was an exposed nerve, and so she made the appointment, and of course it took a while for her to get in. Um, but then they let her know that if it's an emergency, like she says it is, do a walk-in. Go to this location, which is Advantage Dental, and I believe that's down on Gateway. So she went ahead, went in on Monday today, and the first thing that happened was they told her that they don't take the insurance she has, and she goes, "Yes, you do." But they refused. She walked out. Luckily, they're still in the parking lot when they got a phone call having them come back. She went back inside and got some x-rays done. The problem with the x-rays were she had to bite down, and as I told you, she had a hard time biting on anything, so that was painful. And then the guy she got was an Indian guy who basically was hitting the sensitive teeth with a metal tool and offered no help, no medication, nothing. Explained that she's looking at a root canal or an extraction, but it couldn't be done today. He wanted her to come back in 2 months. This is not professionalism. This is not dentistry. If it's an emergency situation, you gotta pull a tooth, you pull the tooth. I get that there may be an infection and it has to go down, so you gotta give them some kind of medication for it. That's fine. Here's the stupid thing, though. 2 months for an emergency. I lost faith in dentists. We all have when we started reading about the corruption and the stuff that they're forcing. Dentists have been lying to the American people for a very long time, cutting corners and stealing money. And that's what this was about. He said that it would cost her $1,300 out of pocket, because I guess that the insurance doesn't cover root canals. And then he seemed a little upset because it didn't happen today. She wasn't going to schedule another appointment or anything. We're in the process of switching dentists, so we wouldn't commit anyway. But the point is, when it's an emergency situation, it's important that you explain to the patient what's going on, what's happening. The dentists we've encountered that were Indian did not explain very well of the dental procedure. I went in to have my wisdom teeth pulled. Did x-rays, did everything. They wanted to do a deep cleaning first. They wanted to do things before they pulled them. I still haven't had my wisdom teeth pulled. They're not bugging me or anything. I'm 27. They're not bugging me at all. So I don't know if they ever will. The problem with it was the nurse I was dealing with, the lady I was dealing with before before the dentist came in, she was poking around with a sharp metal tool at my gums. And when they bled, she let me know that I got gingivitis, and that's why they're bleeding. No, you poked them with a sharp metal tool. That's why they're bleeding. Dentists are ripoffs. I've said it before. You got your doctors, dentists, and your lawyers. They're all licensed con men. Okay, they are. The problem is there's no consequences for them. They can treat these patients any way they want, and there's nothing they can do about it. Every dentist will treat you the same. We've been to so many over the years. and it was horrible. We had a dentist that did patch jobs, so he gave you fillings, but didn't remove all of the decay first, and so the tooth would corrode over time, bust in pieces, and you have to go back and see him. It's his way of making sure he has a job. He did that to my father. My dad's lost almost all of his teeth now because of it. I've only suffered, thankfully, a chipped front tooth from my brother's, and I cracked my molar on a overcooked French fry like last year. So I would like to go in and get some things worked on, but I don't trust dentists right now. So that's the issue. And it's leaving you wondering, is there ever going to be a dentistry practice that doesn't rip off the people? Don't know. No clue. This guy was rude and refused to help, basically, until he got what he wanted. This is not how you run a business when you're in the health profession. You don't play hostage with people's lives. You give me what I want first, and then I'll help you. No. You help the person first, and then they pay. It's not reversed here. Is he illegal? That's a good question. Don't know. We know that the illegals have infiltrated not just our justice system, but also our medical fields as well, so we don't know. At this point, the way that they treat us is not the way humans treat human beings. So it begs the question. Don't know how to answer it though. But I will tell you, it is hard for people in Oregon to get the healthcare they need and the right doctors and dentists. It is extremely difficult for them to get what they need. This dentist office has a lot of bad reviews on it. My mom will be calling the people she talked to that got her into seeing these people and complaining about the way she was treated today. The dentist told her they can't prescribe medications anymore. That's not true. I looked it up in Oregon. They can prescribe medication, but it's only opioids. And they can only give it to customers that or patients that have been there a lot, so that they know the patient. And that makes sense to me. The problem I have is saying that you can't prescribe medication anymore is misleading. It's wrong. It's not the truth. It's a half-truth. And that's what these people do. They give you half-truths. They don't tell you the full story. So, what can be done? Well, the governor needs to investigate. That's what it comes down to. The dentists aren't going to fix this themselves. They're not going to be honest people. So, the important thing to focus on is that the next governor, and then the governor after that, hopefully me, fixes the healthcare system in Oregon. These people deserve to lose their licenses and be not allowed to participate or practice medicine in Oregon anymore. They deserve to have their IDs flagged. They deserve to be shown to the world. This is someone you cannot trust in this field. We have OHP, Oregon Health Plan. Therefore, every place should take it. So the fact of the matter is, these people claim we didn't have the insurance that they take. Yes, we do. These people don't do the research. I have had to pay out of pocket to see doctors just to be told that we can't help you. I'm going to refer you to this doctor. Okay, can I have my money back then? Well, no. I didn't pay for your advice. I didn't pay for you not to be able to help me. I paid for you to help me, not to be seen. Okay? That's stupid. No one should have to be paying to see someone. Okay? No, that's just, again, it's all about money. You don't pay to be seen. You pay to be helped. If they can't help you, you shouldn't have to pay for that. That's just common sense. So that needs to be fixed. I don't know if people will get their money back because it's been going on for so long, but I am tired of it. I am very, very angry that this is the way things are going. And why? Well, Oregon is a very greedy place. These professions that take up more money than you think. And they steal it from us. Because they hold our health hostage. It's not right. There has to be some legal action taken. There has to be something done about this. I'm okay with putting them all on trial, honestly. But I would rather prefer to just revoke their licenses and kick them out of Oregon, if I can. So, that's all I got for today. But, yeah, be aware. Oregon Health Plan is a insurance that should be taken by every medical facility. If it doesn't take it, there's something wrong with that. Also, you need to understand, the doctors over here and the insurance companies, along with dentists, are all corrupt. And this is the way it's working out. I have a doctor's appointment next month, on the 2nd, I believe. And I will give you an update on that, because I don't have any high hopes. I'm trying to get healed by either my shoulders or my lower back, and seeing if we can make something happen with those two things. So we'll see how that goes. If it doesn't go well, you'll hear about it. If it does go well, you'll hear about it. This needs to be addressed. There needs to be a solution, and I am tired of it not being dealt with. Families should not have to suffer just because these companies want money. These dentists want money. These doctors want money. So, that's something I look forward to fixing once I'm governor. Oregon has the worst health care that I've seen. I've seen it firsthand. I've heard horror stories about it. This is not the place you want to go to get help. Unfortunately, if you had the means, the funds, to get the right health care, the right doctors, you wouldn't need to be injured in the first place. That's the way it works. You can try to go to a different state, but they may not take your insurance. Furthermore, you may not be able to afford the insurance that they take. So, it's a very difficult thing to get the right medical for the issues you have. So, Oregon is the worst that I've seen. And I know quite a few doctors here. I know quite a few dentists. So, I don't know what we're going to do. But please get the word out. And if you know anybody that can help with the situation, please reach out. This is one of those things that's just overwhelming. And my mother's in a lot of pain. She's taking Vicodin right now, but that may run out pretty soon. It's just difficult to deal with right now. And to know this guy refused to help. Apparently, he was stating that he couldn't do both teeth because of a time restriction thing. I don't know what that means. But again, they don't explain things very well. And that's the way that it works. If they explain to you about the con, you'll know it's a con and you'll walk away. So they keep things very vague. I don't trust them. We don't trust them. So like I said, if you know any way that this could be resolved, please reach out. If you know someone that could easily help us in Oregon with dentist or a doctor that you recommend that's very good and it's around our area, which is Portland or Gresham, please let us know. The doctors we've seen and people we've met aren't good ones, so we're open to suggestions. I will keep you updated on the progression of this, so stay tuned.